All right, so once again, thank you very much, everybody. So this is going to be a moderated conversation by Department of Mental Health and Addiction Services Commissioner Miriam Delphin-Rittmon. And the way it's going to work is we're going to have the conversation start. And then once the roundtable ends, we will open it up to questions. We'll be able to take several questions through the end of this. If you do have a question, please utilize the chat feature to indicate that you would like to ask a question. And we will do our best to get to as many as we reasonably can. Once again, use the chat feature if you do have a question at the end. And I think that's all from me. Commissioner Delphin-Rittmon, go right ahead.
Okay, thank you, Max. And good afternoon, everyone, and welcome to our virtual roundtable discussing mental health and family services during the COVID-19 pandemic. I'm so pleased to be able to be joined by Governor Lamont and also Commissioner Dorantes, and we have two of our community providers that are here that will introduce themselves and also share about their work as well. I do want to start by just talking a little bit about, first of course, by thanking, Governor Lamont for your leadership and for your steady hand throughout this pandemic. I have so appreciated that state agencies that we've been able to meet regularly and have discussions around what our overall response is. So appreciate your leadership. One thing that we've talked about, and Governor Lamont, you've stressed this as well, is just how important it is to pay attention to mental health. And so, one thing that has been part of many of our discussions is just that, COVID has been, it's been a challenging time, an unprecedented time. And in fact, many people were now, 9 months in, and many people often talk about the COVID fatigue that's setting in, or families talk about the fatigue and stress associated with the economic uncertainty, or this just the stress of not being sure about their own health, their family members' health. And so there's a lot that collectively we're holding and experiencing together. And so I appreciate this conversation as it's an opportunity to talk about resources and supports that are available. One thing certainly that I want folks to know is that there are services and supports available if people are struggling. If you're struggling, certainly do reach out because, again, help is available. Just a few resources that I would like to share that DEMAS has in place. We were lucky to be funded by FEMA and SAMHSA. We have an initiative called the COACH Initiative. It's COVID-19 Assistance for Community Health. That is available on the CT Stronger website. So that's ctestronger.org, or also through 211. 211 can connect folks with the COACH resources. And 211 is another really valuable resource that I want folks to know about. By calling 211, a person can be connected to our mobile crisis services and supports really across the lifespan. I know Commissioner Dorantes will talk about this as well as other services and supports that are available. We have hotlines for young adults. There are resources in the state available for parents that may be struggling, resources related to food availability and food resources. So 211 is just a wonderful hub to be able to get information around a range of needs to include mental health and addiction services. We also have a 1-800 number associated with individuals who may be struggling with addiction. That's 1-800-563-4086. Again, 1-800-563-4086. And that's our access line. And essentially that line will connect a person to really a live person. They can receive an assessment over the phone. And if they need a ride to detox, we'll come and pick them up and give them a ride to detox, even through COVID. So with appropriate PPE, with a larger vehicle, we'll give people a ride to detox if that's necessary. So those are just a few resources that are available that I wanted people to know about. Because again, what we're hearing is the fatigue of COVID is challenging. And we know during the holidays, the holidays can bring up stress as well. And so again, there is support and there is help available if people are struggling. I do want to go ahead now and introduce our first speaker, who will be Tyler Booth. Tyler is the Chief Operating Officer at Intercommunity. Intercommunity is a federally qualified health center located in the Hartford region. They provide a full range of services and supports. And so Tyler, I'll turn it over to you now to go ahead and introduce yourself and speak about some of what you're seeing and what Intercommunity has been offering throughout the pandemic.
Great, thank you very much. Again, my name is Tyler Booth. I'm the Vice President and Chief Operations Officer for Intercommunity Healthcare. We are an agency that has 3 different clinics, one in East Hartford, another in Hartford, and a third in South Windsor, in addition to 7 different school-based health centers that are all located in East Hartford. I don't want to talk too much just about intercommunity services, but more talk about kind of the services that are available to anyone, regardless of their age or demographics. We do run the largest detox in Connecticut, though, and are part of, as the commissioner talked about, their regional transportation. So one of the things that Intercommunity and DEMIS have worked very carefully around is to make sure that people who need to start services can do so in a very safe manner. So we've made sure that even how detox transportation occurs, that's much more localized, so people are in the car for smaller amounts of time. There's a lot of PPP that is being used, so we have that important safety aspects. Whether you are dealing with a substance use disorder or feelings of isolation or trauma or anything else that might be going on in your life, high blood pressure, there are agencies such as Intercommunity that are available to start you with that care today. And if you do not feel comfortable leaving your home, you can do that through telehealth. One of the very important things that the governor did was expand our telehealth services so that it can include telephonic support and can include the very first contact. So if people are in any way concerned about leaving their home, but they know that they can't continue to be isolated, you can pick up the phone and call the numbers that the commissioner talked about. You can call Intercommunity's number or any of the other providers, and they should be able to help you that very same day that you call with some sort of telehealth or a connection to an agency such as mine that can see you in person or via telehealth that very same day. We have seen a kind of vacillation of requests for services. There's certainly many people who are feeling in need. We're seeing a higher number of people with alcohol use disorder coming into our detox areas. And then we see kind of dips again as the kind of infection rates seem to grow, or people get a little more nervous about how to get that help. That's why I want to urge folks to really use the telephonic support, use that telehealth if they're in any way concerned about their own safety. We and other agencies, as I said, do provide in-person, on-site, same-day access in addition to our telehealth services. Another thing that we've really been trying to watch carefully is the impact that folks have with their physical health and how that connects to mental health. Many agencies such as mine provide what we call whole person healthcare. So when you are calling about any issue whatsoever, one phone number is all that you need to be able to have a full assessment of what's going on in any aspect of your life, and we can then connect you with the right levels of care. Intercommunity in particular offers multiple levels of substance abuse recovery supports, including residential care. It's been interesting during the COVID-19 pandemic, there's been a decrease in demand for people to come into those multiple levels of care. I think folks often feel a little bit anxious about going in and living with someone for a period of time. But what I can say, knock on wood, continued, that we have not had a single transmission within any of our programs for COVID-19 that includes our primary care, that includes our detox, that includes our residentials. So it really is a safe environment, and my agency and others are really being cognizant of how to make sure that we can provide care in a safe environment.
Thank you so much, Tyler. I appreciate that. And I appreciate that you mentioned telehealth. I think that's a really important thing for folks to know about, that, you know, if they're not able to leave their home or if they're hesitant, then they can still connect with a provider through telehealth services and supports. Again, through our providers across the state. So that is really, really valuable resource. And again, thank you, Governor, for your leadership. And there have been loosened regulations around some of the telehealth. So it is a nice opportunity for an individual to connect either via phone or other video measures as well. I'd now like to introduce Jennifer Croce. Jennifer is a mobile crisis supervisor, works with United Community and Family Services. And Jennifer will now speak about her experiences as a mobile crisis worker at United Family Services. So Jennifer, thank you for being with us today.
Thank you for inviting me. So I'm Jennifer Croce. I am one of the supervisors for the Mobile Crisis Intervention Team at UCFS. Mobile Crisis Intervention Services is actually a statewide service that's available to help youth going through any sort of behavioral health crisis. The youth and the family identify the crisis and they define the crisis, which is really a benefit because they're the experts on their children and you know when your children are having a tough time. So crises can include things like depression, anxiety, trauma, self-harm, grief, thoughts of harm to self or others, really anything. My team is from UCFS, and so UCFS covers the entire Eastern region. But again, we are a statewide service, so we're available wherever you are in the state. We are contacted by calling 211 and then pressing 1 and pressing 1 again. Important to note as well that we see youth 0 to 18. So throughout the pandemic, we have been contacted by several providers working with kids all across the age ranges. Recently, we've had daycare providers and preschool teachers reach out to us and say that their kids are struggling and they just need some support. And that's where we come in to help. We are a free service. There is no cost to families if they call us, which I think is wonderful. That eliminates one barrier. And we're also available 24/7, 365 days a year. So if someone is in crisis at any time, we are available to help. We're available by phone 24 hours a day. And we have maintained mobility during the pandemic. So we can come out in person. We can provide telemedicine as well. We're really trying to do what we can to keep our staff safe and keep the family safe with PPE and social distancing and telemedicine when people aren't so comfortable. Our mobile hours are from 6 a.m. till 10 p.m., Monday through Friday, and weekends and holidays, yes, holidays, 1 p.m. till 10 p.m. When in doubt, give us a call. We're mobile therapists that can come anywhere in the community. We can come to homes, schools, the park, wherever the issue is happening, and can provide brief treatment and referrals to other services that can help your family during this time. We have noticed during the pandemic that unfortunately we have had kiddos with a higher tendency to harm themselves or have thoughts about harming others. This is in part due to this isolation and this loss of connection with their peers, which is so important for that age range. The loss of that feeling of belonging, unfortunately, I think has really played a role in the increase of harm to self or unfortunate deaths in our area. Children are also grieving the way things were. They're missing being able to see their friends and their extended family. The excitement of transitioning from middle school to high school or elementary school to middle school and all of those things. And they're just missing out on it. And they're grieving a lot like the adults in their home who are grieving their typical lives. Proximity wise, we're pretty far apart at this point, but collaboration wise, we're closer than ever. We're working really hard with schools and other community providers statewide to be able to provide services and help those who need it. Just like Tyler said, care is available and people are here to help. This pandemic has gone on longer than we all thought it was going to last. And unfortunately, we are feeling that fatigue from the stress and the adjustment that came with it. We have more perspective than we've ever had in working with our clients because we are all living through this crisis together and we are all being traumatized and affected by it. I just really want to stress that you are not alone. People are here to help and will listen.
Yeah. Thank you so much, Jennifer. I mean, I appreciate your passion for the work comes through. And so I just love that. And so I commend you and your team for the really important statewide work that you're doing. I think you raised some really important points that, look, you're available all year round, upwards to 10 p.m. in the evening and have been mobile throughout the COVID crisis. And so again, I just commend you and your team for the really good work that you're doing.
Thank you very much. We're very appreciative for the support we've gotten statewide in assisting us with PPE and being there to listen when we have a tough time too.
Yeah, great. Thank you. One thing you mentioned is that the teams, the EMPS, will do home calls for young people upwards to age 18. We also do have adult mobile crisis teams. Same thing, that are mobile, that have been mobile throughout the pandemic, and that will do home visits that are also free, as you mentioned. And so really the mobile work is across the lifespan. And so I think that's really important for folks to know about as well. If there's a crisis in the home, we will come out again with PPE. So it's a safe encounter, but a valuable resource that's available statewide. So, I now want to turn it over to Commissioner Dorantes, my partner in so many areas of work. We were on a call this morning, looking at social justice and managing stress and areas related to that. And Commissioner, I just so appreciate the work that you do and our partnership. And so just want to turn it over to you now.
That's right. Thank you, Commissioner. And thank you to the rest of the panel and to the governor for convening us, because I do think with the seasonality of behavioral health concerns within families or communities, it's important for us to first destigmatize the need or the necessity for help, and to recognize that all of us can help each other to access services. And as Jennifer talked about the lifespan, you might have been surprised that, 0 to 18, that there's even such thing as infant mental health and understanding the stressors that infants experience because of their surroundings. So most people know the Department of Children and Families because of our child protection arm, but we are also the state agency responsible for children's behavioral health. So it's important for us to be a part of this just myriad of services that are available across the state, across the lifespan, and at varying degrees of intensity to make sure that everybody is covered. We talked about this trifecta of the pandemic and economic devastation and racial and social unrest, all convening at the same time or converging at the same time. That's an imperfect storm. And we want everyone to know that although we're separated, we are connected in ways that we can help each other weather that storm. And so, the pandemic has reflected what I've considered to be a magnifier of all of the circumstances that bring families, individuals, and communities to our attention. And so as we navigate the pandemic into the holiday season, it's important for us to recognize that from our littlest citizens that might be serviced through the Office of Early Childhood, through the kids that are represented on the caseloads at DCF, particularly our young people. We've had 2 summits with the children that have been committed to children and young people who are committed to the state of Connecticut. And I can't stress enough the importance of really tuning into our young folks. Jennifer talked about our teens and adolescents really having a tough time right now, and recognizing the need for their means of expression and connecting to resources. 211 has been shared quite a bit here today, and I want people to recognize that sometimes behavioral health shows up in teens and young adults differently. So when we talk about suicidality or self-harm, those tend to be internalizing behaviors. But we also see an increase of family, community, and interpersonal violence. Those are externalized behaviors. So behavioral health shows up in different ways. And we just want to make sure that everyone knows that these things are available. So, preventsuicide.org is also accessed through 211, and the One Word, One Life, One Voice campaign that is the Connecticut Youth Suicide Advisory Board's way of expanding information and knowledge across the state is something that we need to also tune into if you're experiencing those situations. And again, the partnership that I can't stress enough has been expected of the Lamont administration as we at DCF partner with DMIS, partner with DDS, and partner with DSS and aging and disability and housing. And, we've all been leaning on each other to get through this pandemic, and all of our statewide resources, partner with private entities to have private and public partnerships to also weather the storm. So across the lifespan, across the branches, across private and public partnerships, we're all here. And we wanted you to know today that these are the ways that you can stay connected. There's also for providers or pediatricians or people who are working with kids and families can access mental health CT, and then they will be connected to a network of mental health providers along with the 211 resource. So there's lots of ways to be able to get information. And lastly, RAP CT or Connect CT will connect families and individuals to community collaboratives, local groups that are out there, care coordination. There's videos on those websites, again, to be able to just know that you're not alone. And we believe in families, we believe in communities in Connecticut, and we know that we are resilient and will be stronger on the other side of this. But we wanted to make sure that during this time, that there are services out there are resources out there, and again, we're going to get through this together.
Yeah, thank you so much, Commissioner. I mean, so many important points raised there. I love that you mentioned, stigma, that it's really important for us to sort of destigmatize some of the conversations related to mental health. That it's okay for people to reach out and to get support or to get help if that's needed. And then also the other piece that there are a lot of resources available for young people. And again, 211 is just such an important hub to be able to connect to some of those services and supports. Another resource out there is Turning Point CT. And they run a warm line for young people, in addition to the fact that they have such a rich website that has all kinds of resources for young people. And this is run by young people for young people. And so they really do fantastic work. So thank you. And now it's my pleasure, again, Governor Lamont, thank you so much for joining us. And again, for your leadership and often bringing mental health, into these conversations. And so I'd like to turn the floor over to you now as well, to be able to share some of your thoughts. And so I'll turn it over to you. Thank you.
Well, right back at you, Miriam, and thank you for getting us convened. And I got to say, listening to the four of you, you're just doing us proud. And we need you more now than ever. And, Tyler, listening to you, a couple of things came to mind. Your folks are going out there in person. You can't detox virtually, as you told me before. And these are heroes that are going out there and doing what they can to save lives. And as you also pointed out, you've done it safely. And you've done this in the middle of a pandemic, and the folks you're taking care of and the folks who are caring for them are doing it safely. And that's something to remember, that there should be no hesitancy in reaching out to Intercommunity when you're in need. And, Jennifer, 24/7, 7 days a week, Hanukkah, Christmas, Kwanzaa, you guys are there. And COVID doesn't take a break, and our mental health distress doesn't take a break. And that you remind us that you're there, there's no hesitancy. You're there and it's free, no questions asked. You're there, no stigma. You're there privately. These are messages that we've got to relay, especially now. And, Vannessa, as you were reminding me, DCF and more broadly, our state government provides a continuum of services for all ages and all demographics. And, Beth By, maybe early childhood, and DCF taking care of those kids and making sure that they have the support and the love and that they need going forward. And then you move to, Miriam and Jordan, and making sure that folks in special need, we realize what a tough time this is right now and what you do on their behalf. And then all the way to the nursing homes. And you want to talk about isolation. I was the guy that had to say you can't go see grandma in the nursing home because of what that meant in terms of the spread. And we set up everything we could so you could connect and link and FaceTime. That's not so great with grandma sometimes, FaceTime. And and we've got to continue to reach out there, even, as we, as Jennifer said so well, we're separate but still connected. And that just reminds me, I mean, you may be in quarantine, but you're not alone. And if I got one message I've heard from each and every one of you, and the amazing angels that you represent are out there taking care of people, you may be in quarantine, but you're not alone. And being alone can sometimes create incredible distress. We call it quarantine, they call it isolation. I hear it on the 211 calls as people share with me. You've heard it, Jennifer gave me a word I wasn't familiar with, harmicide, and just some of the erratic behavior that sense of isolation can bring on people. Just the abuse lines we hear, domestic, child, and sometimes our schools are a first line of response. We don't all have, not all the kids have the opportunity to go to school right now. And a lot of our clinics are not open right now. Again, 211 and the hotline is reaching out, what that's so important. And the addiction services out there, alcohol, opioids, these things get magnified and abused during a crisis like this. The shootings, I mean, shootings are at, generational highs in a lot of our cities. And a lot of that reflects the isolation, the frustration, and the fatigue related to COVID. And I really, Miriam, I'm so proud you got us together, because I'm spending about 20 hours a day thinking about physical health. And I don't have good news to share on that. I don't want to add to your frustration, but our infection rate went from 4.6 to 6.6 to 8.6% today. 8.6% of the people we tested positive, which is by far the highest number that we have had since we've done broad-based testing. 40 more hospitalizations. We look at that metric very carefully. Another 18 fatalities. And believe me, I don't say that to depress you. It's the reality we live in, and it's why what you're doing is more important. I mean, as I think about things, this is the holiday season, and Thanksgiving and Hanukkah and Christmas and Kwanzaa, and the times we get together as a family should be a source of joy. And it's also a time when people are getting together, sometimes without a mask. We knew that Thanksgiving may result in a bit of a spike up in our infections, and here we are 2 weeks later. We also know that holiday seasons can be a source of joy, also a source of incredible isolation for people, as we look at those happy scenes on TV and wonder, why am I alone? And I just say two things. One, to each and every one of you, not on this panel, not related to a service organization that's doing God's work, reach out. Reach out to a friend, reach out to a friend of a friend. You don't have to visit. In fact, don't visit. Just do it by phone. Just give them a call. If you got a grandma in the nursing home, give her a call. This is a really important time to reach out. Somebody who's been living alone for a while, give them a call. Do what you can so they can stay home safely and they know that they have their link there. And on a personal note, to each and every one of you, thank you for what you do and all the folks that you are representing. All the folks who can't telecommute and virtual, and you're out there every day, as Jennifer said, round the clock, taking care of people. And you've got 211. You all gave me lots of websites and numbers. All I remember is 211. And I love the fact that that's a way that you should know that on the other side of that line, you've got a friend. You've got a verbal hug. You've got if you're a teen, we can get you in contact with another teen. If you have a crisis, we'll get you in contact with the right person. And this could be the ultimate present you give this holiday season, that gift of love to a lot of folks who are in need. And that's why, Miriam, thank you for getting us together.
Well, you're welcome, Governor, and just thank you so much for your comments, and just again for your transparent leadership. The data it's challenging in terms of where we are as a country, but I think having that information allows us to plan together It allows us to plan as a state together around how we'll get through this together. That there are resources. Again, 211 is such a rich hub in terms of a range of different resources and supports that are available. And Governor, I also appreciate that you mentioned that, you may be isolating, but you're not alone. That by reaching out to 211 and connecting with one of the specific hotlines, there are lines for older individuals, for young folks. There are virtual groups where people can get connected and feel less isolated. But also, as you mentioned, Governor, reaching out to a family member or a loved one or a neighbor or a friend that may be going through a hard time or somebody we know that may be COVID positive. All those ways of reaching out, I think, can help people to feel less isolated and feel the love. Sometimes we don't talk about love enough, but I think love during a pandemic like this is so critical. And we all know that just love can be healing and how important healing is during this tough time. So I appreciate everyone's sort of comments and perspectives and just the really passionate work that you're doing in it day to day as we go through this pandemic. Jennifer, one thing that you mentioned that I'd like for us to talk about a little bit more is just, how young people may be struggling, how they may feel particularly isolated and maybe engaging in behaviors that are hurtful. In addition to the mobile services and supports that you offer, I'd like for us to talk a little bit about just, other services that are there, but just also how young people can help, can manage some of those challenging feelings or emotions they might be experiencing. And really anyone. I know, Commissioner, there's a lot of resources that DCF has, or Jennifer, Tyler, Governor. So just open it up and then we'll certainly take questions as well.
Absolutely. So I'll start. So again, that loss of connection is really what our kids are struggling with the most. And I think anything that can foster connection is great, whether they find a pen pal and write letters, or they set up Zoom meeting with their friends, or they send these dance challenges and things that are popping up all over the place back and forth, really stressing the importance of that connection. I know parenting is tough and behaviors are tough, and kids, when they're acting not so nice, sometimes lose their phones or lose their iPads. But now, with kids not being in school, that's also a loss of the connection. So maybe parents can find some wiggle room that the children, they still need consequences for behaviors that aren't the best, but that aren't taking from them what they're already losing. Parents also need to remember that they are their kiddos' calm in the storm, and they are going to feed off the information and the emotions that the parents are giving them. And so while it is definitely easier said than done, it's really important to watch our responses to the kids as well, so they don't continue to feed off of our stress and our adjustments.
Yeah, thank you so much. Yeah, absolutely. I think the piece around sort of tuning into our own stress and having that self-awareness so that the ripple effects of our stress doesn't flow on to the young people in our lives is so critical. That mindfulness piece.
Yeah, Commissioner Cardona and I have been talking a lot about that across connections between child protection and education, because the adults that are connecting with kids in the education space also, have had to think about how do you connect with children differently than you would if you were face to face in the classroom. And it's that same notion, Jennifer, of, tuning in and recognizing that we're all experiencing these stressors, but that shows up in kids as kind of toxic stress. So paying attention to their social emotional learning and, recognizing that kids kind of express themselves in lots of different ways. And as adults, we are the ones that do level set things for them. So that was so important to raise that up. And, mobile crisis and emergency mobile psych are one provider, but Connecticut is resource rich and providers across the span that really can do telehealth appointments, and whether they're in person or telephonic on the phone, we've got great clinicians out there that really can meet you where you are. So no matter where your family is, whether or not you've accessed behavioral health services in the past, or you're new to asking for help, they can meet you wherever you are. So physically and emotionally. So I'm so happy to have Emergency Mobile Psych as part of our service array for young people and families, because, we're here to help each other, but those kids are in the context of families and communities, whether it's in school or other ways that they communicate with each other. And we just have to kind of help them get through this hard part.
And if I could quickly add to that, if your child's school has a school-based health center, most of those are still open, even if the school is only doing remote learning. You can contact the school-based health center and still be connected to a therapist or a primary care provider. And any agency, like in a community that's a federally qualified health center, we see all clients regardless of their ability to pay. So concerns about COVID or concerns about finances should not stop you from asking for help.
Great. Thank you, Tyler. Thank you. So, I believe, we can go to questions. I just want to be mindful of time. Max, shall we go to questions now?
Yeah, I think that's exactly right. If you
Okay.
have a question, members of the press, please utilize the chat function. The first one that came in is coming from Matt Karen. Matt Karen with Fox 61. Go ahead.
All right. Hi, everybody. Thanks for doing this. Commissioner Delphin-Rittmon, it's good to see you feeling well. Governor
Thank you,
Lamont,
Matt.
I just had a couple questions for you. On the report from the White House that was sent to you last week, that was recently made public, it had some recommendations in there. It warned that Connecticut was considered to be in their red zone. Was there anything that you got from that report that you didn't already know? And was there any actionable things that you did once you received that report?
No, I think, Matt, it really reinforced what we've been trying to do, and they saluted Connecticut for taking the right actions on a personal basis that are by far the most impactful. It was less about, shutting down things and more about those personal interactions and wearing the mask and the distancing that can make a dramatic difference. And yeah, we were in the red zone, and so are about 49 other states at this point. But I appreciate the support and insight we get from Dr. Birx and the COVID task force.
Okay. On the vaccine, the president has said that he will sign an executive order requiring American vaccine makers to give the vaccine to Americans before other countries. But Pfizer has said they have orders committed with other countries. It's going to limit their availability to deliver more doses to the United States. So I guess, are you confident that Connecticut will be getting all the doses that we need to stick to the original timeline?
Well, the White House would have been smart to pre-order more from Pfizer, as we found out they had the opportunity to do. You can't interrupt contractual relationships that Pharma or Moderna or Pfizer have done. We do know that the number of vaccines, the amount of vaccine is going to ramp up dramatically. But Matt, no question about it. We found out, today that even one vaccination can make a difference. And the faster we get that available to people, the more supply we have, we get that out there, the better it is.
All right, one more for you, if I could. And I don't have to tell you this. It wasn't long ago we had those large vaccine protests at the Capitol. I know that you've said you're not considering making the COVID vaccine mandatory. Can you explain why that is? And that being said, why there was such a strong push to limit some exemptions for other vaccines that are mandatory?
I just don't think I have to have that battle yet, Matt. It's going to take us many months before I have enough vaccine to take care of all the tier 1 and tier 1B and first responders, and not to mention the general population. And if I can get them voluntarily to do it at 70, 80%, let's get the vaccines to people who want it voluntarily as quickly as we can. If we find at the end of the day, later this spring, there's a significant portion of the population that refuses to get vaccinated and it's not getting the job done, we can rethink how we encourage people to do this, but we don't have to cross that bridge yet. Right now, we're getting the vaccine, we're getting it distributed to the people most in need where it can make the biggest difference.
Thanks.
The next question coming in is from the Associated Press. The question is two-phase. Number one, is there a way to quantify the problem with the pandemic and attempted suicide? And on the issue of suicide, has it risen and by how much?
So Commissioner, I can take the first portion of that as it relates to children. I'll talk to you about completed suicides more concretely. For us, we recognize that Connecticut typically is on the low end of completed suicides, but we all know that one suicide is one too many. So we typically average around 8 completed suicides a year with children under the age of 18. We are at that number at this point right now, with 4 of those having occurred in October. So, you know, our Office of the Child Advocate put out an advisory for us to tune into our young people specific to that statistic. Commissioner, you may have some additional information as it relates to suicidality among young, older adults or adults that are outside of that range, but I wanted to offer those statistics related to young people.
Yeah, no, thank you, Commissioner. And so similar for young people, in terms of adults, Connecticut is often below the national average again, or as well. But again, even one suicide is too many. We know even one is too many. We are watching our data and looking at it to see where, what our end of year data will look like. And then certainly a goal will be to compare it to sort of what we saw last year. And so we should see, we should have some data soon. At this point where we were this year compared to last year, it was right around the same. We weren't seeing a significant spike in terms of suicides this year compared to last year for adults. But again, that data is still coming in. And so it's something that we're watching and tracking. Sometimes the holidays are a rough time for folks. And so certainly working to get information out there about resources that are available. Our national suicide hotline now actually goes through 211 as well. So 211 is the Connecticut portion, that is, of the national suicide hotline. 211 is the hub for that. So that's an important collaboration that we just started. But it's an important question and certainly an area that we're tuned into and looking at. Any other questions?
The next question is coming from Patch. Could you quantify the increased use in mobile crisis among children and adults since the pandemic began? Probably a good question for Jen regarding your experience.
So I will say that our call volume is definitely still on the rise. We did have a change previously where most of our crisis calls were coming from schools in previous years, whereas now more calls are coming from families and children themselves. We've noticed a wonderful trend that if children see something that their peer has posted on social media or their friend has said something that's concerning to them, the children are telling trusted adults so they can get the help that they need. And that's the part I'm choosing to focus on.
Yeah, and in terms of, adult mobile crisis, we're seeing a slight increase, and I think where there is a change is in the nature of the calls and where some of our staff are going to. As a function of COVID, the Department of Housing has done a lot of really, really good work with, working to have individuals who are homeless really stay in hotels so that they do have a place to stay. So some of our calls in some instances have been around supporting individuals that are in hotels or, around the state as we typically do. And so that's been an area where we've seen probably a slight uptick, and we need to look at that final end of year data as well.
Another piece of that response, because if I look at the question in the chat, it kind of speaks to the need for inpatient beds. And, a lot of times, part of the reason why we had this convening today is an emergency department might be what people think is their first choice to be able to address a behavioral health issue. And emergency rooms, while equipped, really shouldn't be your first choice. There's a wide array of whether it's mobile site crisis services that come to you or other services that you have access to that we've talked about here today. And, when we think about the need for emergency departments in a pandemic, you might want to think about that along the continuum of most need versus other mechanisms and options that you might try first. So this is a great opportunity to be able to share with people, not only those that are hearing this particular roundtable, but others who may not have access to information, that there's so many other resources that can be accessed before you might access an emergency department for a behavioral health crisis.
Yeah, no, thank you, Commissioner. And one initiative that we have in place, so for so certainly I think it's important to explore other resources and supports, because emergency departments, certainly what we're hearing from healthcare providers, there's certainly a lot of, activity and flow there. For individuals that do end up in an emergency department, and if they're struggling with substances, we do have our recovery coach initiative where recovery coaches can be connected with individuals who are brought to the emergency department as a function of some substance related emergency. And the recovery coach will really work with the individual over time to help continue to make calls, work to connect people to services and supports. And so that's an ongoing resource that we have as well. I think another resource that's really important in terms of the availability of beds is, we have a real-time bed availability website. And this has been just such a strong collaboration across all providers in the state that have either mental health or addiction beds. And so I do have to give a shout out to providers, because they're sending us their real-time information regularly so that we can update that website. And so on any given day, we are able to tell where there are mental health beds, where there are detox beds, where there are recovery beds, or even sober home beds if it's a sober home that is certified. And so that is available on the DMIS real-time bed availability website, and 211 can give you information about sort of linking with that as well. But that will let folks know sort of where the beds are available. And what we find is that on any given day, there are beds available. We often are up around sort of 90, in the 90s in terms of capacity, but it ebbs and flows in terms of where in the state beds are available.
I can just interject. It's a really useful tool. While the commissioner was talking, I checked, there's currently 17 open detox beds in the state of Connecticut, that if someone called right now, we would be able to pick you up and drive you there in a safe vehicle. So these resources really are available for folks.
Yeah, thank you. Thank you, Tyler.
And it's important to lift up the comorbidity between substance use and mental health or behavioral health concerns, because they oftentimes go hand in hand. And so to pay attention to one, you really do need to tune into the other.
Yeah, absolutely.
I believe we have time for one or two more questions if reporters want to utilize the chat function.
And Max, if I may, the one last point I'd like to make in the last few minutes that we have, I would be remiss if I did not mention that Connecticut is a safe haven state, which means that a child under the age of 31 days or younger can be brought to an emergency room as opposed to being abandoned. And sometimes that's another way that mental health shows up in parents who might find themselves unequipped to be able to care for a child.
All right, I believe that is all of the questions. I would like to thank all of our participants today. Thank you, Governor Lamont, for joining us for this roundtable. If you have any follow-up questions, you can get in touch with the governor's office or all of these agencies directly. Thank you very much, everybody.
Take care, everybody. Hey.
All right. Thank you, everyone. Take care.
Amazing. I never knew what a mobile crisis supervisor did. Now I know exactly, Jennifer. You're amazing. Tyler, thanks for all your help here, man. I knew what you did. Take care, everybody.
Thank you, Governor. Take care, everyone.
Goodbye.
Bye.